Hello and welcome. Buenos días, buenas tardes, buenas noches. It's great to welcome you all here today to talk about inequalities in health and health systems in Latin America and the Caribbean. This is a journal launch from the International Journal of Equity and Health, and I am Daniela Rodríguez, along with my co-editors from this special issue, Pablo Gaitán Rossi, Daniela Maceira, and Ana Lorena Ruano. I'd like to welcome you. These are your special issue editors. Pablo Gaitán Rossi is a researcher at IJEqH at Universidad Iberoamericana in Mexico, and he works on health equity, program evaluation, and implementation science to improve food security, mental health, and early child development. Daniela Maceira is a professor and senior researcher at the University of Buenos Aires, the CEDES, and is also the HSG board member representing the Americas. He's a health economist focused on financial protection, program evaluation, sexual reproductive health, and adolescent health. I am an associate scientist at Johns Hopkins School of Public Health, and I'm also chair of the Translating Evidence into Action Thematic Working Group for HSG. I'm a health systems researcher focused on evidence use, donor transition, and political commitment. And Ana Lorena Ruano is the managing director of the International Journal of Equity and Health. She's an associate professor at the Center for International Health at the University of Bergen in Norway. She's a sociologist focused on health system governance, RTH, and social accountability. Next. As we get started, a few tips on using the platform. Remember that there is a support function on the top right-hand corner that you can click that says live support to access any help at any time. We also have a live Q&A session going on the right-hand side of your screen. Please send your questions in the live Q&A session. For the best experience, please use the session in full screen. And remember that our sessions are being recorded to be and will be available the next day and will remain available for 14 days after the conference. And adjust your browser zoom to have the best experience. Also, we ask you to take this opportunity to introduce yourself in the discussion forum so we can get to know you better and so that everyone can begin to interact. Thank you. Next. So if you could launch the poll, please. We wanted to ask everyone a question about whether you have read a journal publication that included evidence from Latin America or the Caribbean in the last 12 months. You should see a poll pop up in your browser. Please take a minute to answer this question so we can reflect on how much visibility evidence from Latin America and the Caribbean is having in peer-reviewed publications. Okay, next. Hello? Next, please. Thank you. So as we move forward, we wanted to talk through with you the rationale for the special issue. There are conditions in Latin America and the Caribbean that significantly impact health systems, as you might see in many regions. There have been efforts to capture economic development through health reform to achieve universal health coverage. But there is still deep internal inequality and marginalization of vulnerable groups. There's a complex relationship with democracy and governance. There are high rates of informal work and out-of-pocket expenditures for health, and high quality and equitable health systems are still elusive. Despite the growing portfolio of health policy and systems research in Latin America and the Caribbean, there's still a limited reflection of the region's experiences and the lessons learned in the global literature. Next. So we launched this call for publications focused on an equity lens, looking to capture multiple disciplines and methods, and trying to ensure as much variation across the region and countries as we could. The areas of interest that we addressed are around health inequality and differential impacts for different populations. We wanted to learn more about barriers to care and health financing and governance. 97 abstracts were submitted for consideration to our call, and about a third of those were invited to submit full manuscripts for peer review. And we have about 15 accepted publications after peer review right now. And we have grouped these as part of this presentation into several themes that we see emerging across these. But what you'll notice as we go on to describe them is that many of these papers cross boundaries. Next. I'm now going to turn it to Pablo Gaitán Rossi, my colleague and fellow editor, to talk about the publications of the special issue. Pablo?
Yes, thank you. Good morning, buenos dias to everyone. Good night, maybe to some. I wish to present the first set of articles that we compiled for this special issue. So you could see if actually we kind of achieved what we intended with what Daniela presented. We organized this first set of articles in 5 parts just to kind of give them like an internal structure of what we think are like common themes or common topics in what's happening in Latin America and the Caribbean. First, we want to stress out that sometimes like health reforms or better legal frameworks, even additional health budgets might not be enough to lower inequalities in Latin America. So we address this issue in this part, like stressing the importance of governance and accountability. First, we wanted to highlight that we still faced a lot of social exclusion from different groups, and that's a hindrance to achieve the universal health coverage. So it's important actually to highlight the need for more citizen-led accountability as the one seen in Guatemala and Peru. We also identify that other articles highlighted the need for governance, for participatory governance effort in health and other sectors. And that's what we're seeing in this alliance between society and the state. And this paper addresses what's going on in Brazil and Venezuela. And another particularly important issue in Latin America, it's about internal migration and what we're seeing in Colombia, especially with the migration from Venezuela, and how that's impacting the community participation addressing different health issues. Next, please. The second part, it's one that's been a common topic in Latin American academic literature, a big concern, is with vulnerable and marginalized populations. Particularly, this set of articles address the sexual rights and how these are a particularly difficult topic with the LGBTQ community. And in this paper, they focus on the trans people and how do they get access to health services in Colombia. So this is about a particularly vulnerable population that's been excluded for some of these services. Also, the obstetric violence continues to be a common issue or a common problem in several parts of Latin America, but this paper focuses on what happens in Guatemala and how it's related with the maternal height. And lastly, also another common topic that we saw, but this one's focused on Brazil, is the different barriers to primary healthcare. This is also a common concern that one important from a health systems perspective. And this paper does a really good job on highlighting which are the key barriers to access to primary healthcare. Next, please. Now, the third part of the issue focuses on more from a more structural perspective and shows different equity gaps that still persist in the region. First, we know that even in some of the best performing countries like Chile or Uruguay, there's still some equity gaps that persist and that need to be addressed. And most of them have been related to particularities of the system architecture. Particularly, we're concerned about the system's segmentation and how that is related with maternal mortality. So what these papers are trying to show is how the health systems of the different countries might have different health outcomes, especially in maternal mortality. Next, please. Then this fourth part is an interesting one because what these authors are trying to do is make some comparative analysis. The first one, they address the indigenous populations, which are an important share of the population in Latin America, and they try to draw lessons of the differential health outcomes from different countries. Particularly in this one, they're comparing Brazil, Chile, with Australia and New Zealand. So very different countries with different health systems and the way they address the health of these vulnerable populations. And the other is how these normative frames, how they impact in the way health systems work, particularly in conditional cash transfers, which is a common strategy to address or to reduce health inequalities. But what's the differential impact that this is having in countries from the region like Bolivia, Colombia, Ecuador, and Peru? And next, please. And finally, the last part is focusing on health service delivery and planning. In this one of the big concerns is the changing populations of the region, and especially that's something that's happening in the whole world, but how the health systems are coping with different health profiles. In particularly, the first paper focuses on like the strain the diabetes prevalence might put on the healthcare system. Another issue that's been of important concern is the growing population. Now we have a larger share of older adults, and how this needs to change the way health services are provided, and how these changing populations might be increasing health inequality in specific regions. And also how the different health systems fare when addressing inequality, particularly decentralized systems, and the one in Argentina, how do they address, or how do they create and address inequality in these kinds of systems? And lastly, I want to highlight one paper in which we are also like showing like new and like innovative methods to understand inequities in Latin America. Particularly, this one's a methodology to estimate small area prevalence based on survey data. So even though this is they're using these methods in Brazil, we believe that similar methodologies can be translated to different contexts, and in that way we might improve our understanding of health inequities in Latin America. Thank you. I hope you enjoyed this first set of articles for the special issue.
Thank you, Pablo. And if we can move on next, I think now Ana Lorena is going to lead us through a discussion amongst the editors, and then we'll be turning to the audience as well.
Hello, everyone, and welcome to our discussion on our special issue on Latin America and the Caribbean. I'm very happy to be able to be here with you and to share this collection, this first collection of papers, which we think captures in some measure the complexities of Latin America, our health systems, and the challenges that we face. So first, we're going to spend about 10 minutes talking with the guest editors, and then afterwards, we hope to engage all of you in a deeper discussion. So if you would please go over to the site and you see there's a live Q&A. If you have any questions, please feel free to write them there. In the meantime, I would like to welcome all our guest editors, Daniela Rodríguez from Hopkins, Pablo Gaitán Rossi from IJEqH at Universidad Iberoamericana, and Daniel Maceira from CEDES and the Universidad de Buenos Aires, and our regional board member. Can I ask you all to turn on your cameras? So we've been working on this now for, I would like to say, since the day we met in Liverpool. So this has been 2 years in the making. How is it your experience engaging with research in the region? Maybe I can ask Daniel, since he has engaged so deeply and has really fostered the ability to publish among Latin American researchers.
Thank you, Lorena. Well, I think that we as a region are facing a challenge in terms of translating our experiences in research and policymaking into journal articles, and to share them not only within us in the Latin American region, but with the rest of the world. And that's why I'm thinking that initiatives like this are important, because it's like the way we can translate those experiences into tales that people can read, understand, and debate, improving our way of researching and participating in the overall debate about how to improve health systems performance.
I agree. From my perspective as a journal editor, over the 12 years that I've been in the journal, I've really had to go, it's been an uphill battle to try and get more papers from the region published, not only because there's a lack of research being done where Latin Americans are thinking about ourselves and researching about ourselves and publishing, but also because there are very few venues that are able to put forth this knowledge that is in English. Anyways, we tried very hard to have a collection of papers that would reflect to some measure the complexities of the region, but we weren't able to capture everything. What do you feel was missing? And what should we emphasize in the years coming forward? Pablo.
Well, I would say, I mean, I would agree with you that we have like many problems, huge problems, complex problems in the region, but we're struggling like to hone in the message, you know, like picking up which ones are the key problems, how are we going to address them, which are the best methods to do that, and how are we communicating that message. So I think that we would need to be like closer to the authors. I think that we need like a longer work with the authors, not just like the common exchange with the editors or a journal that you have a paper, you send it, then you wait for the comments and that's it. I think that journals need to be more open, like to receive some papers that might seem as work in progress, but that they might show some promise, and editors should be willing to work a little bit more with these authors, because I think there are like really good topics being addressed in this in these papers, but we need to do a better job in translating them to an academic language that might communicate better to the rest of the world.
I agree with you. It is my experience from working in Latin America and also seeing the papers that we get in the journal from all over the world, that many times I see a paper that was trying out something that we already worked on in Latin America and that we know that won't work, or that promotes segmentation or fragmentation or furthers inequity. And we have no way of sharing this or of saying, no, stop before you do this. It's a waste of time and money. It won't lead to a positive outcome. And I think that that is really the biggest frustration that I feel as an editor and as a health systems researcher working at the global level, seeing how our evidence doesn't get translated into useful, actionable information for other governments and for other researchers.
Lauren, can I come in on that? Because I think,
yes.
So going back to sort of your original question, what is also missing here? You know, we are very much aware that there are no papers from the Caribbean in this collection right now. And we're acutely cognizant of that. We did have some submissions, we invited manuscripts, it didn't actually turn into published papers. And so that there's obviously a gap there that we, the four of us, but I think also the industry more broadly needs to explore about what additional barriers are there in place for folks working in the Caribbean. And I would say that the other, from a topical standpoint, we had some submissions around dental health that we think were very exciting that didn't come to fruition, but they also highlighted, I mean, at least for me, it pointed out that there is a gap in my health policy and systems research knowledge and the kind of reading that I do about dental health and how much it connects, how that is its own system and how it connects. What does it mean around when we're talking about health financing and insurance and all these kinds of things? Are we considering those additional, what might be considered ancillary services, but are actually fundamental to good health and well-being?
I agree with you. And this brings the interesting perspective that we have not overtly considered. And it's the intersectionality aspect of researchers in Latin America and the Caribbean. As a journal editor, I can also tell you that we receive very few papers about oral health, both systems-wise and about prevalence or incidence of diseases. And that when we do get them, I try very hard to foster their development and to make sure that we publish them. But this is hardly, I don't think we get 5 papers a year in maybe around 1,000 that we get submitted. So it's a very low prevalence. And when that is also mixed with being from Latin America or the Caribbean, the language barriers, the publication costs, the fact that so many Latin American countries are considered low and middle income, or then it means that we don't qualify for as many waivers for publication. And I think that that's a big deficit. And from what I've seen from the Norwegian cooperation, international cooperation, there seems to be some barrier thinking that it's our inability to speak English, which is holding us back from engaging more overtly with donors and with the dissemination of our information or the data that we produce, when in reality, other continents and other countries that don't speak English are much more engaged for other reasons. So I think that it's not just the role that we play as researchers or that the journal plays, but also the larger donor organization and what gets funded, because it's very difficult to get funding for Latin America. I don't know if this is your experience, Daniel.
Yeah, that's clear. Asia and Africa have been receiving a lot of support from European countries because of the colonial past in developing research abilities. And this is not happening, this haven't been happening in Latin America. And so that creates a lot of barriers to get access to funding, especially, as you said, Lorena, because the Latin American and Caribbean countries are middle high incomes in comparison with other continents, so the access to resources is lower. And also because of the disparities among countries, and we have this barrier between English speaker countries in the Caribbean and the Spanish and Portuguese speaking countries in the rest of the continent. And so that's another provide an additional challenge to communicate with each other. The good news is that through Health Systems Global, we have been developing a series of activities together, and the idea is to open the discussion for more cross-country analysis, and this journal is clearly one example of that. And in addition, under the wing of Health Systems Global, we created already the community of practice at the University of West Indies in the British Caribbean. And we are holding meetings trying to improve the possibility of having new material from those countries and to share them with the rest of the region and the world. So probably in the next few months, we will have some additional material to share with the rest of the Latin American and Caribbean community.
And then finally, before we close this segment of our launch, there's something that we haven't discussed at all, which is COVID and how it's affected the region and what kind of lessons we can learn from the way that we've handled it. I think it's very clear from the way that the different countries have managed and from the state of the health systems as a result of the COVID pandemic, that segmentation and fragmentation are really key things that not only the region, but the rest of the world needs to work, because we have seen from the experience and the evidence from Latin American countries that a fragmented and a segmented health system is not able to withstand the shock that a pandemic creates. What sort of reflections or papers do you think would be interesting to expect for this special issue or our thematic series, which we hope to keep running until 2022?
So I joined a session yesterday on in the symposium around COVID-19 response in 4 or 5 countries in Latin America. So it's Argentina, Chile, Costa Rica, and Ecuador, I think. And what was really striking to me was seeing all the things that kind of were similar and then a few things that were different. But this idea that by having such a robust private sector, what does that mean? And a robust private sector, a large informal working population, unemployment going up, it's a sort of whole, overlapping things that we're seeing them obviously play out in other regions. But in a region where ostensibly there's more health protection than in other places, in theory, in quotation marks, right? how the systems respond, and the reality that the governance systems and the interconnection between or sort of the drive for a clinical response when it's actually a public health response that's needed is continuing and historic, and that's not going away. No. So how do you capture those? I think capturing those lessons, taking those people from those presentations yesterday and getting them to capture that. I think it also brings, I think, a bigger question for us as a field that I think we should interrogate. The region actually has some reasonable public health journals in their local languages, right? In Spanish and in Portuguese. So what does it say that in order for them to get it, for research from the region to get attention, it needs to be published in English so it can be found and read in other regions, rather than, because otherwise the lessons stay internal, and that's good to some extent, but they become insular. And I think that's a bigger problem that the field has to deal with as a whole, especially as other regions start to push and champion regional journals.
Yep. Well, Latin America remains one of the most understudied region in the world, and it's the most unequal for sure. Mm-hmm. So we have a comment from Emily, and we haven't quite moved from Emily Vargas, we haven't quite moved to this section, but I think it's interesting that an issue is not just the production of evidence, but evidence uptake. And then what is the culture that governments have, that decision makers and duty bearers have to uptake the production, the evidence that we produce, that we publish in the journal. And I think that that's another disconnect, and it's very difficult because all countries and all regions are having issues with how to input evidence into policy making. And so it isn't just a challenge that we face, but when that is compounded with the lack of production and the lack of publication. Daniel, would you like to say anything?
Yeah, I've been studying, my country, Argentina, and looking at the rest of the countries in the region. And the problem that I see is that the segmentation of the system is not only in terms of how to produce high quality and opportunity and with great opportunity of access to health services, but also how to produce and coordinate the collection of data. So, and that increase the challenge, and not only in doing research, but also in the policy making process. I think that the lack of coordination across subsystems in any Latin American country is bringing a problem that we had under a stress situation is much higher. So, and the possibility of putting together data and having the opportunity of producing policies that are urgent responses to the problem that we have are huge. So the possibility of having research opportunities here and create the possibility of interact with the public sector is extremely important. But as I said, the lack of information is bringing a lot of challenges that we need to solve immediately.
Pablo, and then I have one more question for all of you.
Yes, I just want to add some other ideas to this interesting topic. I mean, I think that we've been seeing the strain on health systems worldwide. However, I think in Latin America, this strain is it's singular because, as you've said, we're facing like a fragmented system. But that fragmented system, what does it mean in terms of the outcomes from the COVID pandemic? I think that we're seeing like the consequences of having underfunded health systems, but some parts of their systems are worse than the others. No, I mean, at least in Mexico, we're seeing the lack of protective equipment. No, we can get some of the basics right, and that has differential outcomes. I mean, we have parts of the system that are underperforming, and we need research on what's happening there. Why is that happening there? I mean, I just want to comment on something that's happening in Mexico. That's many people are avoiding the hospital. They don't want to go to the hospital. They prefer to stay at home. And I think that needs to trigger a lot of reflection from what kind of health system do we have. And I think that the COVID pandemic, probably not now, but sooner rather than later, should implies some health reforms. And I think that research is going to play a key role in on the direction that the health system should change in order to improve in many of these issues that have been evident during the COVID-19 pandemic.
I agree with you. And I think that research does play a key central role in this, but then we come to another issue that's very Latin American, and it's the lack of capacity to produce this research. I'm sure you would all be better able to contribute stats from your respective countries or subregions within Latin America. But I can say that at least in Guatemala, out of 18 million people, less than 500,000 people have an undergraduate degree. And so then that makes it very difficult because the capacity to produce academic grade evidence is just not there. We don't have people with PhDs. I think in 2010, the count was 74 people with a doctorate in all of Guatemala. So how can we produce this? And this leads to the important question of how we can create partnerships between ministries of health and universities to train human resources, to train them to the doctoral level so that they can produce this sort of evidence.
I think that you're raising an interesting point, because if the policymakers are not relying on the information and the knowledge that researchers bring to the table, it's very difficult sometimes for institutes, research institutions and universities to have the environment to create a sound research programs. And so probably we need to develop trust between both spheres, like researchers and policymakers, to see how useful researchers can be to the policymaking process, and how policymakers are able to learn from the knowledge that the researchers bring. And this is something that will take time, and there is no other possibility of doing so without improving the ties between one area and the other, especially because in the region we keep talking about segmentation, and we are talking about financing and the provision of services, but there are many other topics that need to be addressed in terms of how this segmentation create biases in terms of rights to health, and how the lack of coordination requires a lot of regulatory efforts to put a sound and equitable national strategy. And this is something that we need to discuss and to improve, and perhaps using this academic fora to send this message out.
Before I give the word to Daniela, I think that a key thing that we haven't been able to exploit as well as other regions of the world have is this revolving door that can exist within public health between academia and ministries of health, with decision makers and duty bearers, that we see in other continents, where people at the Ministry of Health can carry out PhDs with universities that are partners, and that helps them not only be able to better understand the problems, but to understand the evidence and then uptake it in a more meaningful way. But Daniela?
Yeah, so I'm not going to touch on the brain drain going on in Venezuela, because that's a bigger historical political thing that we can talk about. But one thing I do want to raise is that I think if you looked at different countries in the region, or even the region as a whole, right, you may actually see, proportionally speaking, maybe some higher educational levels, undergraduate degrees, or even doctorates than you would see in other regions. But I think one of the things that doesn't get unpacked enough is who are the people that get to access those higher levels of education.
Yes.
And how does being those people frame the questions that you ask and how you ask them, and what interventions you design. Because I think if you look at Venezuela prior to all of this, right, there was reasonable access to university education in many places, certainly in capital cities of different states and stuff like that. But going beyond that was a huge privilege, a privilege primarily of class, but also to some extent of race, and certainly of gender. And so then if I look at the pipeline of people who were ahead of me, people who would have been my peers or people senior to me, it's mostly men, it's mostly middle upper income, and mostly white. The only difference between me and them is that I'm a woman. And so that implies a particular lens in how you see issues and how you study them. And I think one of the things we were able to capture with this issue that was really nice is some papers that are really focusing on issues of vulnerability and marginalization, right? We have a paper on trans folks, which is like practically radioactive in Latin America. We have a number of papers on indigenous populations, but it's not enough. It's not enough because so much of those different levels of marginalization are not only not talked about, but they represent proportions of the population, in particular among the indigenous, who are large. I mean, we haven't even talked about sort of descendants of African slaves, which is a whole other sort of layer of marginalization and vulnerability. So just to say that I think even the educational pipeline has something to contribute to sort of the lenses through which we look at these issues.
I agree with you. A big push that we've had on the journal over the last few years, and certainly under my tenure, is that we can't is the premise that we can't really understand and act upon equity unless we have a plethora of different voices, of different methods. And we can't really understand if we don't have the voices of people from the communities that are vulnerable, that are marginalized, that are historically excluded from these processes. And we can see it in our issue that even though we touch on some, we don't have anything from Garifuna people or from Afro-Caribbean populations. We don't have anything from the Caribbean. Well, there's a mix of women and men in our authorship. I would say that they all belong to the dominant ethnic group in Latin America, which is the same dominant ethnic group to which all four of us belong to. Daniel?
Yeah, no, just building on what Daniela was saying, I think that we need to build a way of share and respect each other's knowledge and views. And this matter of respect of the knowledge of the other is particularly important in countries where cultural differences, where original population has important presence, and so I'm thinking that the pandemic is giving us as societies a great opportunity of locating healthcare in the center of the agenda and start discussing these issues that have been hidden for ages. So I know I'm optimistic today. So I'm thinking that perhaps that's it happens from time to time. And I'm thinking that perhaps this pandemic is bringing this opportunity, to once in a very long while, you see that health is in the political agenda. So use this as an opportunity to discuss how to be inclusive, how to coordinate activities, how to engage other actors in the discussion of a more sound healthcare system building. And start to think about what are the rigidities of our systems, and perhaps we have the opportunity to start changing them.
So our time is almost up. So I would like to ask all of you to give us maybe 2 or 3 things that you see are missing and that you would like to foster or promote authors for submitting. From my part, I think I would really like a deeper reflection on the private-public partnerships and the privatization processes that are happening in health systems in Latin America. And I would certainly welcome papers that are both qualitative and quantitative about the experience of the Garifuna in the north coast of Central America and Afro-Caribbean populations in the rest of the region. Daniel?
Yeah, on top of what we were saying up to now, I think we need to start thinking about how to create some methodological background for those people who are working in the healthcare system, will be able to translate their experiences into articles or papers that can be shared and discussed with the rest, not only with the society within the country, but also at the regional.
Pablo?
Yeah, I would say that we're still missing large parts of Latin America and the Caribbean, particularly the Caribbean, and we need to do better, like including them and highlighting some of the issues that are happening there. But because I think we still don't know, there are many things that we still don't know, the Caribbean, but also from indigenous populations. And the other thing that I would also want to stress out is but we know we need more information about mental health inequities. I think this is
Yes.
another big
Yes.
topic.
Especially given the deep-rooted conflicts and war situations that so many of our countries are doing. Certainly, mental health is an issue. Daniela, to close with a...
So two things that I think, well, two areas I think. One is building on what Pablo was saying, the long history of health is political, right? So I would love to see more historical papers looking at the effects of civil wars and guerrilla warfare and dictator and authoritarian regimes to understand how that has shaped how folks in Latin America have framed and then implemented health and public health work. And I also would like to see more health systems work around the surrounding countries to Venezuela and how they have adapted their health systems to deal with the refugee crisis, because it's an unusual crisis in that there's been this massive exodus to a bunch of middle-income countries that were kind of left to deal with it on their own for a long time. I mean, with some support, but and that has implications not just for how the local health systems have taken on these refugees, but then also how they've taken the folks who are a professional standpoint to then employ them. I mean, we hear stories of doctors that were then put into rural areas because none of the locals would work there. So those kinds of stories I think would be really, really intriguing. And with that,
we give the
floor to Daniel.
Yes, Daniel.
Oh, thank you.
Yes.
Well, thank you, everybody. As you know, this special supplement is a key activity that we launched to start preparing the region from Bogota 2022. Yeah. Here you see in the screen the way how to access to this collection of papers. And this is part of an overall strategy that we started more than 40 years ago with Health Systems Global to improve the relation between policymakers and researchers in Latin America. The aim is to improve the ability to communicate our experiences and to open the debate with other regions, and to we have another opportunity in a couple of years in Bogota to show the rest of the world where the Latin American and Caribbeans are able to develop. And so we need to invite you first for tomorrow. We have a session tomorrow that is part of the program where, as part of the regional chair, I would like to share with you the results of some data we collected based on the abstracts of 11 pre-conferences that we held during the last year all over the region. And we can start thinking about how to make Bogota explotar de casos latinoamericanos, and to bring to the discussion regional experiences, how to make us more frequent participators of the thematic working groups and the emerging voices and all the rest of the activities that the society had been developing in the last years. Thank you. Over to you, Lauren. Do you want to close?
Oh, I am unable to start video. Yes. I would like to thank all of you for coming. I would like to thank all the authors for all the work that they put in. Oh, now I'm at to start my video. And I would like to thank all of you for attending. This has really been a dream for me to have this collection of papers, to work with such capable, interesting, and really just amazing co-editors. Daniela and Pablo and Daniel have been the perfect partners in this crime. And I look forward to continue to building our cache of papers for Bogota. And I look forward to us being able to meet together, all of us in person, and talk about the richness and the complexities of inequalities and health systems and all about Latin America in 2 years.
Thank you, everybody. Next, please. We'll see you in Colombia.
Nos vemos en Colombia.
Ciao.
Ciao.
Ciao, ciao.
Adiós.